Hello everyone, my name is Dr. Lucia Cagnes, board certified OBGYN, streaming from the beautiful Cape Cod in Massachusetts. Welcome back to my YouTube channel about HPV infection. Today we're diving into an essential topic, which is the role of the immune system against HPV infection. HPV infection is the leading cause of cervical cancer in women and has been associated to head and neck cancer, anal cancer, vaginal and vulvar cancer. We do not have any medication that is effective against HPV. The first line of defense against the virus is our immune system. What is the immune system? Immune system is made by two different components. The first component is the cellular component, which is mostly represented by T cells, B cells, killer cells. Those cells recognize the foreign pathogen and attack it with the aim of either destroying it or neutralizing it. So T cells are involved in the protection of our body against HPV infection. The second component of the immune system is represented by the humoral component, which is basically the antibody that are secreted by mostly the B cells. The antibody recognizes the foreign agent, which is mostly represented by bacteria, but can be represented also by toxin that inadvertently can cross into the blood circulation. These antibodies are several different kinds, depending on their function. In general, they are supposed to block and neutralize the foreign pathogen of the toxin. So what happens when the virus, the HPV virus, is in contact with our tissue? It can be at the level of the skin, it can be at the level of vaginal mucosa, it can be at the level of the cervix or the vulva, it can be at the level of the mouth, tongue, throat, even esophagus. The virus is very insidious because it can easily escape recognition from the immune system. And that's why HPV infection is so potentially dangerous. The virus has ways to block the immune system from recognizing. Therefore, has the ability to stay latent or dormant, usually in the basal layer of the tissue, can be the skin or can be the mucosa, and hide in the area for even years and decades. When the immune system is down for different reasons, it can be a transient illness, it can be because a patient is on immunosuppressant, or it's taking cortisone for asthma or manage other clinical conditions. The virus might sense the opportunity and start replicating really fast. That means that the virus start causing a serious infection of the cells, using the cell's genetic material in order to reproduce itself. This is the active infection. We can recognize when the virus is active because it typically will show up in the pap smear We also have tumor markers like oncoprotein E6 and oncoprotein E7. They are present in the pap smear, but the provider needs to request specifically this test. When the tests are positive, means the virus is active and therefore is its most dangerous level. I want to stress the importance of repeating the pap smear for women on a yearly basis, because HPV infection can become active anytime in the life of the person and without any warning. HPV infection, in fact, does not cause any symptoms unless it creates the presence of a tumor. It can be a large tumor, a large mass that is causing some problem and is recognized upon medical examination. We can only detect HPV when it's active. And we can, again, request some specific markers with a pap smear that will alert us and alert the provider that HPV is not only active, but is inducing an active transformation at the level of the cells. Our immune system is our greatest ally in the fight against HPV infection. By understanding its basic functioning and the role in combating pathogens like HPV, we can better appreciate the importance of maintaining a healthy immune system. Thank you for watching this video. Please do not forget to like, share, subscribe for more informative content. Stay safe and healthy, and I'll talk to you soon. Thank you for listening.